afternoon. It's a great pleasure to be here. I want to thank Vicki and the Simsman Institute for inviting me to share a stage with such inspiring speakers and such amazing, talented individuals. I'm very happy to speak with you today about research in my lab with my students and colleagues on shaping executive function skills. And specifically, we're going to focus on what is it that caregivers can do. So what is executive function? We've been talking about that term quite a bit today already, and many of the speakers before me have alluded to it. So executive function refers to the higher order skills that we use to govern our thoughts, actions, and feelings. So it's called executive because it's almost like an executive in the brain, the CEO in the brain that's directing in a top-down fashion how to pursue our goals and maintain our goals and think, act, and feel in accord with our goals. So how many of you have heard of the marshmallow test? Yeah, okay, most of you have. So as shown here, the idea is children are brought into usually a lab situation and told that you can have one marshmallow now, or whatever the treat of choice happens to be for that child. Or if you wait until I come back, you can have two. So it's a smaller reward now, which is quite tempting. But the long-term payoff of waiting and enduring that delay is to have a larger reward, which pretty invariably all children say that they would rather have the larger reward. And so the rule of the game is to stay in your seat and wait until I come back and don't eat the marshmallow, okay? And it's quite challenging, as you can imagine, but what it's doing, in order to endure this delay, children are really drawing on these developing executive function skills. And typically we think of three facets of executive function that all work in concert with one another. I like the idea of the skill rope. They're sort of inextricably linked and work together to help govern our thoughts, actions, and feelings. So in the marshmallow situation, the child says to herself, I can remember the goal of this activity, using her working memory. I can wait to respond and see my choices more clearly, or remember that I'll get the larger reward if I can inhibit in the moment, using inhibitory control. And lastly, I can think about this in a new way, or distract myself. What if I imagine this delicious-looking marshmallow instead as a white, fluffy cloud? So that's exhibiting cognitive flexibility or shifting. So again, all three of these work together. And I'm going to show you an example. This is a 4-year-old child in our lab who has chosen Fruit Loops for her treat. That is a strong favorite in the lab. And on her left, she has a smaller amount. And on the right, she has a larger reward of Fruit Loops. There's a bell in the middle, and she's been told that if she wants to, when she wants to, she could ring that bell, and the experimenter will come back into the room. And that's perfectly fine, but in that case, she only gets to have the small tray, the small bowl of Fruit Loops. If she waits and does not ring the bell or eat the Fruit Loops until the experimenter comes back, she gets to have the large pile. So let's see what she does in this situation. So as I mentioned, those three facets of executive function are quite inextricably linked. So if any one of them fails, the whole system fails. And so she remembered the rule. I think we know that because she tried to cover her tracks. But what failed there was the inhibitory control, where she just couldn't resist the temptation. She had to lick the sugar off and wipe her hands clean, put it back. So it's a great example of a difficulty with executive function, especially in the early years. Interest in the topic of executive function has really just skyrocketed in the last 20 years since I've been doing this research. The number of publications has increased threefold, specifically using the term executive function in children ages 0 to 12. And what this research has shown us, to kind of summarize 20 years of research, is that, lo and behold, children attend to highly salient, tempting, and often misleading aspects of objects or events. In other words, they tend to be very reflexive. So responding to things out of habit, responding to things in a way that is not very well or carefully thought out, sometimes not consistent with their goals, kind of knee-jerk responses. Instead, what happens in the course of development, or what needs to happen in the course of development of executive function skills, is to learn to step back and consciously attend to your goals, and, in other words, be more reflective. So the developmental task before young children and their caregivers, because these skills take a while to develop, is to help them move from being reflexive to reflective. A more sort of portable measure than the marshmallow test that we've developed to study and learn about basic development of these skills in especially early childhood is a tool that my colleague Phil Zalazo and I developed called the Minnesota Executive Function Scale, or the MEFS. And it's a tablet-based task on an iPad or an Android. It takes less than 5 minutes. And what children have to do is sort cards, these virtual cards, into one of the two boxes that you see on the screen according to a rule. And at the lowest levels of the task, the rules are really simple. But at the highest levels of the task, it gets very complex and even tricky for adults to perform well or to perform quickly and be successful on this task. So it has 7 levels of difficulty, and using this measure, we've been able to trace the development of executive function from age 2 and up for the first time ever on the same scale, not having to change tasks every year or so in order to get at these skills. And it's been normed on 7,500 children ages 2 to 13. So we have a really good sense of how children perform on this measure and how that changes with age. And what I want to show you here is how executive function, using this tool, increases dramatically in early childhood. Performance peaks, so where you're the most accurate and fast on this measure, around 25 years of age. And then, unfortunately, it begins to decline. However, I'm convinced that adults who stay active and go to think tanks do not experience this decline. Looking more closely at early childhood, this is performance on the MEFS from age 2 to 9 years of age. You can see the really dramatic kind of stepwise progression in development. But children with low executive function skills on this measure and others at kindergarten entry tend to be distracted, fail to remember rules, act out in class, learn less effectively, get in trouble, suspended, or even expelled. And we had great testimony from Jonathan Mooney of that earlier today. And I want to point out that these effects, when the environment doesn't change and when you don't have a supportive advocate to help change the course of development, these effects tend to persist well into adulthood, predicting health, wealth, and well-being in adulthood. And in fact, it's not just kindergarten teachers that are hoping to see these skills when children arrive at their door. It's also college admissions officers that are hoping to see these skills. And it's also employers who are hoping to see well-developed executive function skills as a strong predictor of achievement. However, for children who live in adverse circumstances and poverty-related stress, executive function skills tend to be less well-developed and take longer to develop. What we're seeing here is performance on the MEFs by children measured in a laboratory, in community preschools, and an at-risk sample of children who were living at the time in homeless shelter. And all three of these groups have equivalent age and equivalent IQ as statistically equated. And what you see here in the at-risk sample is a gap, significantly lower executive function performance. And again, it's not due to age and it's not due to IQ. This gap, we believe, is the kernel or one of the kernels of what blossoms then into the achievement gap when they enter school without these skills as typically developing. So we are asking, what can we do to promote executive function skills in preschool children who may lack resources? In some of the work that we're doing with older preschoolers, where we're targeting the kids themselves to help them develop these skills, we have been working with things like pretend play and mindfulness. But one of the focus of the think tank and a lot of our other work is on what about the antecedents? What about birth to 3? What's happening there to help set the stage for executive function development? And here we kind of think about the adage of first things first. We've learned a lot today about the importance of adequate economic resources, nutrition and early feeding practices, routines for sleep and for living, and reduced stress as being critically important in setting the stage for healthy development of executive function skills. Another sort of first thing first that we've heard a lot about today is quality caregiving and individual differences in caregiving, particularly sensitive and synchronous caregiving. I'm going to spend my time then talking a little bit more about a specific type of parenting called autonomy support. This stems from self-determination theory, and the idea is that children build their cognitive and social skills first through interaction with an adult who, in a sense, scaffolds those skills. And just like you might think of using a scaffold to help you construct a building, you have to make it strong, and eventually you can remove the scaffold and hope that it will stand on its own. That's the idea with autonomy support, helping the child to feel successful and a sense of mastery. If you're working on a joint problem-solving task, let's say you're trying to teach a toddler how to dress himself, or an older child with their homework. It's important to help the child develop a sense of, hey, I can do this, and not taking control over the task or intruding, and not letting the child struggle too much on his or her own. Helping the child just enough. So this requires the adult to think about the child's perspective, engage in some mind-reading activity with the child, to respect the child's pace. If you've ever tried to get a toddler to childcare in the morning and he wants to learn how to dress himself, it's really hard to respect the child's pace, right? And ensure that the child has an active role in the task, so you might give him a choice of which shirt to wear today, and offering suggestions. Like, you know what, maybe we'll just take the slip-on shoes today instead of the ones that require you to learn how to tie them, because we're in a hurry today. So we measure this in the lab by having adult caregivers and children do a joint problem-solving task. And so by design, the task is just a little bit too hard for the child to complete on his or her own. They need adult help to do this. So what we have here are puzzles or tangrams. And you'll see an example here of what we call high autonomy support. The adult is really supporting the child's autonomy or sense of agency of I did it. And what you'll see is a preschool teacher doing this with a child who's just turned 5. And just notice how he asks open-ended questions, respects the child's pace, and doesn't intrude on the task and try to do it himself. Okay, we'll go ahead and play it.
So, I think you might be right. It might fit better. So if we switch it with the yellow one we just put on, so we have that green, and there's another piece that goes with the green.
I have these blue ones,
Me
but
too.
it's not the diamond, it's a square thingy.
It is, but it looks like the blue. One side is touching the green side, and it seems to turn it a little bit. What happens if you try that?
Okay, so giving hints, suggestions, allowing her to try it and think how she would do it, how she would solve that problem, and not taking credit for accomplishing the task, allowing her to have the credit. In contrast, this is a preschool teacher with a 4-year-old child who is low in autonomy support, relatively low in autonomy support, and is more controlling. And what I want to emphasize here is that this isn't bad caregiving. I'm not going to show you, horrible, abusive caregiving. These are individual differences that we've determined help to predict more versus less well-adapted development of executive function skills, and trying to learn, what is it that caregivers can do that would be more optimal. So let's take a look at what this teacher does.
Now we need the red ones. The red trapezoids, we need those.
Which way do they go? This way?
Yep, they go this way. See, there's a space between those two, so we need to make sure we get the space in between. So like that, and then this one goes in the front.
They go on the sides.
Yeah. We need one more. No, it goes over here. Nice.
There's an opportunity there to ask a question. And instead, she dictated, no, it goes over here. And so, again, these are subtle things, but if you imagine it en masse, of this is what interactions with my caregiver are like, more often than not, that the child in the first example is going to develop a sense of autonomy, and the child in the second example is going to have a little more difficulty in doing that, or take a longer time to do so. In this last example, what we call laissez-faire parenting or caregiving, the adult is not terribly supportive or controlling, but instead is kind of checked out and allowing the child to struggle on her own. So this is with a 3-year-old child. It's a mother, and the mother has been, she's in the lab and has been instructed to do this activity with your child, and she's on her cell phone during the engagement. So let's take a look at this.
Does this fit?
What do you think?
Yeah.
There's one part that doesn't fit. Which part doesn't fit?
This one.
Mm-hmm.
She had a bid from the child. She responded to the bid, but then went back to the phone. Now, I'll be the first to admit that I've done that with my own kids, of being a little too attached to the cell phone. So again, it's not to say that no one does this or you should never do this. It's what becomes typical in that dyad that can help alter the course of development. So this dimension of autonomy support is the caregiving dimension that's most consistently associated with executive function in our research, even above the effects of other dimensions like sensitivity. And it's associated with preschoolers' emotion regulation, with executive function tasks across childhood, and with academic achievement into high school. So why would this be the case? Why would that type of parenting help build executive function skills? When parents engage with their kids like this, or preschool teachers, teachers engage in this way, they're encouraging children to explore new problems, leading to greater persistence and opportunities for new problems. And practice with executive function skills such as making decisions, reflecting on your options for responding, and identifying and correcting errors in their work. And adults, you'll notice they're very verbal. So even with a child who's not yet using language, adults will, who are high autonomy support, in autonomy support, will use this type of language, modeling the way that they're thinking about the problem for the child, who then internalizes that way of speaking to themselves through self-speech. And lastly, the adult is modeling good executive function, him or herself. So we've learned that, not surprisingly, being autonomy supportive requires executive function. So think about it. You have to inhibit the reflex to take over and say, hurry up, let me do it. You're taking too long. And come up with new strategies, think ahead, consistently plan, and as I said earlier, think about how the child is thinking. And in fact, parent performance on the MEFs, because it's a lifespan measure, parent performance on the MEFs is highly correlated with their autonomy support parenting. And this is true in both mothers and fathers, in both wealthy and poor mothers, and even when controlling for the mother's IQ. So again, this isn't just a proxy for IQ. Executive function has specific and unique predictions for parenting and child outcomes. And it's also not just a simple transmission. You might think, well, the shared genes and so forth, that's going to count for a lot. But in fact, what we find is that it's a pathway through the quality of parenting that is what accounts for the links between parent executive function and child executive function. It's not a direct path. What about dads? So admittedly, most of the research on parenting has focused on mothers. One of my students, Alyssa Mavison, has been very interested in father autonomy support and father parenting. And the upshot of her research has shown that father's autonomy support versus control is related to child executive function, similar to mothers. But she also found that stimulation in play seems to be an area where dads play a unique role. So dads sometimes engage in more rough and tumble play with kids, and she was interested in looking at that as a context for their developing executive function skills. And we weren't sure how to do this, so eventually what we decided to do was rent out a gym. So we brought dads and their 5-year-old child, 4 or 5-year-old child, either son or daughter, to the gym. And we just, for 10 minutes, said to play. And we made it a little bit of a task where you had to, go to at least 4 stations. Make sure you hit 4 stations during this. And what we found was that there are individual differences in how much dads are stimulating or overstimulating their kids in this context and dysregulating them. What I'm going to show you here in this last example is a father with a 4-year-old son, and he's been encouraging the son to get up on top of the monkey bars and crawl across the top of them. And the son has been reluctant to do this. The dad picks him up and puts him on top of the monkey bars, and this is what happens next.
Get a crawl on your knees, no. Crawl on your knees. Okay.
No, I want to get down.
You're just gonna make it a couple. You gotta make it a couple steps. You gotta put your butt down. Butt down. Butt. Your butt's gotta go down. Okay. Well, I might have to leave you here. No, just go on your knees.
Okay. So again, not too unlike something that you might see on a playground, and we do see some sex differences with fathers and sons in that type of situation versus fathers and daughters, more encouraging of that risky play with sons than with daughters. But what we found is that being out of sync, again, to harken back to the earlier talks, being out of sync with the child is what seems to be relevant for the child's development of executive function. So our conclusion from this research, this body of research, our own and others, is something like the story of Goldilocks and the Three Bears, that there's something that to parenting where you don't want too much support or control, nor too little, but something that's just right, right? Optimal, in the middle, not too much support or control. So our last question, and next question that Alyssa Mavison has been pursuing is, can autonomy support be trained? So what we tend to do in the lab is try things out in a relatively safe context toward interventions, some training studies. If we get traction in the laboratory, we then would try to bring that into a field setting and see if it works there, and eventually try to scale things up. So this is just the very beginnings in a lab sample. We had moms or dads, equal numbers of each, come in with their son or daughter, 3-year-old child, and we did the puzzle task in the dyad and coded for autonomy support. That's the baseline. Then we divided them up, and half of them were instructed to do it again. But this time, I want you to do it with these actions, what we call autonomy support. So we actually coached them in how to be more autonomy supportive. The other group was actually coached to be more controlling. So because we're psychologists and we're really interested in mechanisms, we want to know, can you move the dial in both directions? That would give us lend greater support to our theory of change. So they were actually instructed to be worse parents, and I will let you know that we did debrief them at the end. So when they were instructed to be more controlling or less autonomy supportive, one thing was clear. It's easy to make parents worse, okay? And so when they started out as high in autonomy support, after being instructed to be more controlling, they really dropped. And even the group that was lower in autonomy support to begin with got worse. When instructed to be autonomy supportive, to be better parents, if you will, instead, it turned out to be a lot more difficult. So we did see that the group that started relatively low did get better. That's encouraging, because that was our goal. And ultimately, that's our goal, is to work with parents who lack these skills and would benefit from coaching. However, the group that started out really high, almost at the very top of the scale, there was sort of almost nowhere to go but down. And it could be a regression to the mean. But what we're doing next is to capitalize on this finding with low baseline parents to begin with and see if we can help move that further. And this is my last slide. So executive function skills take a long time to develop, and it's important to a host of life outcomes. It depends in large part on early experience, although it's never too late to affect these skills. And adults can do many things, only some of which I've mentioned today, including thinking about this adage of Goldilocks, parenting, and also remember that children learn from watching. So as we heard earlier in Andy Meltzoff's talk, they're watching and they're taking notes about how you control your own thoughts, actions, and feelings. And lastly, we're hopeful that autonomy support can be coached in parents who lack these skills. So extra thanks to my colleague, Professor Annie Bernier at the University of Montreal, who helped me get started on this path of research, and my students Alyssa Mavison and Rebecca DiStefano, as well as funders. Thank you so much.